We're going to look at dural venous sinuses in this model. If you look on Blackboard, there's an excellent video that shows the dural venous sinuses in motion, and you want to take a look at that. It's a short video, about 5 minutes, but seeing it animated, I think, really is very helpful. What we're going to look at here is right down the center. This is our falx cerebri. It separates the left and right hemisphere. And if you look in the falx cerebri, on the top you have your superior sagittal sinus, which runs anterior to posterior, and on the bottom you have your inferior sagittal sinus that runs anterior to posterior. The inferior sagittal sinus is going to go into the straight sinus. This is the straight sinus that goes to the back, and the superior sagittal sinus goes directly to the back. This region is called the confluence of sinuses, where your straight sinus and your superior sagittal sinus will meet. From here, you will then go around. This is the transverse sinus that goes around. It goes around this edge here. So this is called the tentorium cerebelli, this dural extension, because it forms a little tent over the cerebellum, tentorium cerebelli. And similar to the falx cerebri, we have an extension that comes out here. It's not shown in this model, which is the falx cerebelli, which separates the two halves of the cerebellum. So if we follow the dural venous sinus flow, we go from superior sagittal sinus into the confluence of sinus, inferior sagittal sinus to the straight sinus to the confluence of sinus. So here we are at the confluence. We're going around the transverse sinus. Let me turn this around here. From the transverse, we're going to go into this little segment here. This tiny segment is called the sigmoid sinus, and this is going to drain into, it's going to connect with the internal jugular vein, and it's going to drain into that, and that goes through the jugular foramen. So for this class, the 311, this is the pathway that we need to know of the dural venous sinuses. At this time, don't worry about the other ones. We'll save that for a later course. One of the beautiful things about this model is you can see all 12 cranial nerves on this model. So right up here in the cribriform plate, this is the bulb of the olfactory nerve, that's CN1. Here, coming through the optic canal, we see CN2. Right below that is our internal carotid artery, and this is a portion of the circle of Willis. We're going to go down and look in our superior orbital fissure, which is right below this wing. You can see 3, that's our cranial nerve 3, oculomotor. Do you see this little white dot here is oculomotor. Let me push this out of the way here. 3, the wire that comes out is 4, which is trochlear. Just so you're aware, some of the models in the lab do not have a trochlear nerve, but that is number 4. Then as we come down, we see this large bundle here is cranial nerve 5 trigeminal, and if we turn that around, we can see 5 sub 1 ophthalmic going through the superior orbital fissure, 5 sub 2 maxillary going through the foramen rotundum, and 5 sub 3 mandibular going through foramen ovale. We also see the middle meningeal artery here going through the foramen spinosum. We'll turn this back. We had all of them except 6. Here's number 6. That is our abducens. Here it goes up and then goes through the superior orbital fissure. Here, this is the petrous portion of our temporal. We have 7 and 8. 7 is facial, 8 is vestibulocochlear. Remember, your face is more medial and your ears are more lateral, so the more medial of the two will be facial, the more lateral of the two will be vestibulocochlear. We're going to go down to the jugular foramen. This is where the dural venous sinuses joined up. We had that sigmoid sinus joining our internal carotid artery, but we also have going through the jugular foramen 9, 10, and 11. 9 is glossopharyngeal, 10 is vagus, and 11 going down here is spinal accessory. Coming around foramen magnum is 12, that's hypoglossal, and the large one down here, of course, is the spinal cord. If you look on the very bottom, either side, coming here and here, these are going to be your 2 vertebral arteries that also pass through that foramen magnum. The last dural fold that I want to show you is actually hard to see on this model because you just see a little bit of it here. But if you could imagine a fold that goes over the sella turcica, that's called the diaphragma sella. It forms a diaphragm over the sella turcica. On this model, the skull, what I've done is I put a little piece of tape over the sella turcica like this, and that's what the diaphragma sella would look like. This is on your structures list, so I want you to be aware of the concept. Again, the only place we can see it on the pocketbook model is this little slip of dural fold that should cover the entire sella turcica. That's called the diaphragma sella.